Front of thigh. Front of thigh is also known as the anterior compartment of the thigh region. Its contents are as follows: superficial fascia, deep fascia, fascia lata, muscles of anterior compartment, femoral triangle, femoral vessels and nerve, adductor canal. Fascia of thigh. It is divided into superficial part and deep part, which is known as fascia lata. Superficial fascia. It consists of two layers: superficial fatty layer and thin deep membranous layer. The superficial layer is continuous with the superficial layer of abdominal wall and fuses with the fascia lata inferiorly and is parallel with the inguinal ligament. It is made up of areolar tissue containing fat with superficial vessels, nerves, and superficial lymph nodes. The deep membranous layer of the superficial fascia is very thin and fibrous. It is present beneath the subcutaneous vessels and nerves and upon the surface of fascia lata. It is closely adherent to the fascia lata, a little below the inguinal ligament. It covers the saphenous opening. The portion of fascia covering the saphenous opening is perforated by the great saphenous vein and by numerous blood and lymphatic vessels. Hence, it has been termed the cribriform fascia. Cutaneous nerves. They are derived from the ventral rami of lumbar plexus. They are lateral femoral cutaneous nerves, a direct branch of lumbar plexus. Intermediate femoral cutaneous nerve, medial femoral cutaneous nerve, and saphenous nerve from the femoral nerve. A branch from the anterior division of obturator nerve. Ilioinguinal nerve. Femoral branch of genitofemoral nerve. Deep fascia or fascia lata. This encloses whole of the limb as a stocking, but varies in thickness in different parts. Attachments. The fascia lata is attached above and behind to the back of the sacrum and coccyx, laterally to the iliac crest, in front to the inguinal ligament and to the superior ramus of the pubis, and medially to the inferior ramus of the pubis. Ischium and tuberosity of ischium, and to the lower border of the sacrotuberous ligament. Distally, the fascia lata is attached to the patella and inferior margins of condyles of tibia and fibular head. It forms the roof of popliteal fossa and continues with deep fascia of leg. The deep fascia of thigh presents two modifications: iliotibial tract and the saphenous opening. Iliotibial tract. It is the thickening of fascia lata on the lateral aspect of the thigh and forms 2.5 inches wide band. Above, the iliotibial tract splits into two layers to enclose the tensor fascia latae. Superficial layer. It is attached along iliac crest, and the deep layer blends with the lateral part of the fibrous capsule of hip joint. 3/4 fibers of gluteus maximus are inserted into the posterior part of the iliotibial tract. Inferiorly, it is attached to smooth area on the anterior surface of the lateral condyle of the tibia. Functions. It maintains the knee in extended position when the knee is straight. In semi-flexed knee, it exerts an anti-gravity force to support the knee joint in walking and running. Saphenous opening. The saphenous opening is an oval opening in the fascia lata, 4 centimeters below and lateral to the pubic tubercle. It is made up of superficial and deep layers. The saphenous opening is covered by the cribriform fascia, which is pierced by the great saphenous vein, which drains into the femoral vein. The fascia forms a sharp falciform margin lateral to the great saphenous vein. Structures passing through the saphenous opening are great saphenous vein, superficial epigastric and superficial external pudendal arteries, few lymph vessels connecting superficial and deep inguinal lymph nodes. Superficial inguinal nodes. These are present in the superficial fascia. These are arranged in the form of a T. It consists of upper and lower groups. Upper group, horizontal group, consists of 5 to 6 nodes present below the inguinal ligament. They are subdivided into lateral and medial group. Lower group, vertical group. These are about 4 to 5 nodes placed along the upper part of the great saphenous vein. Cutaneous arteries. These are 3 small arteries arising from the femoral artery below the inguinal ligament. They are the superficial external pudendal artery. It pierces the saphenous opening and supplies the external genitalia by passing in front of the spermatic cord. The superficial epigastric artery. It pierces the saphenous opening and supplies the lower part of the anterior abdominal wall below umbilicus. The superficial circumflex iliac artery. It pierces the deep fascia lateral to the saphenous opening and runs upwards towards anterior superior iliac spine below the inguinal ligament. Great saphenous vein. This is the longest and thickest walled superficial vein of lower limb. It begins on the medial side of the dorsum of foot and runs upwards and backwards anterior to the medial malleolus, and then on the medial side of the leg and behind the knee, and inclines anteriorly to enter the femoral vein through saphenous opening by piercing the cribriform fascia. It receives superficial external pudendal vein, superficial circumflex iliac vein, and superficial epigastric vein before draining into the femoral vein. Intermuscular septa. Between the proximal and distal attachments, the fascia later sends intermuscular septa to the linea aspera of the femur. These are anterior, posterior, and lateral intermuscular septa, dividing the thigh into anterior or extensor, posterior or flexor, and medial or adductor compartments. Muscles of the anterior compartment of the thigh. The quadriceps femoris, tensor fascia latae, articularis genu, and sartorius. Quadriceps femoris. These are powerful extensors of knee joint. It consists of 4 parts, namely vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. Rectus femoris. It is a long fusiform muscle. It has 2 heads of origin, straight head and reflected head. Origin. Straight head from anterior inferior iliac spine. Reflected head, a groove above acetabulum and fibrous capsule of hip joint. Insertion into the base of the patella through the quadriceps tendon. Nerve supply. Posterior division of femoral nerve. Action. Flexion of hip joint. And it assists in extension knee joint. Vastus medialis. Origin. From the lower part of intertrochanteric line. Spiral line, medial lip of linea aspera, and upper 2/3 of medial supracondylar line. Insertion into the medial 1/3 of the base and upper 2/3 of the medial border of patella. Nerve supply. By nerve to vastus medialis from the posterior division of femoral nerve. Action. It extends knee and stabilizes patella. Vastus intermedius. Origin. Anterior and lateral surfaces of upper 3/4 of shaft of femur. Insertion to the base of the patella. Nerve supply from the posterior division of femoral nerve. Action. It acts as an extensor of knee joint. Vastus lateralis. Origin. From the upper part of the intertrochanteric line, anterior and lower borders of root of greater trochanter, lateral lip of gluteal tuberosity, and upper half of lateral lip of linea aspera, and also from lateral intermuscular septum. Insertion by a broad aponeurosis into the tendon of rectus femoris, lateral part of the base of the patella, upper 1/3 of the lateral border of patella. It gives fibrous expansion of lateral patellar retinaculum to the lateral condyle of tibia and blends with iliotibial tract and the capsule of the knee joint. Nerve supply by the posterior division of the femoral nerve. Actions: it extends the knee joint. Articularis genu. Origin: it is a detached part of vastus intermedius and arises by 2 or 3 slips from anterior surface of femur below the origin of vastus intermedius. Insertion to the apex of suprapatellar bursa. Nerve supply by a twig from nerve to vastus medialis. Action: it retracts suprapatellar bursa during extension of knee. By this action, it protects the suprapatellar bursa. Sartorius. Origin: from the anterior superior iliac spine. Insertion into the upper part of the subcutaneous medial surface of shaft of tibia. It resembles upright hockey stick with the concavity facing below. Nerve supply by the anterior division of femoral nerve. Actions: it is a flexor, abductor, and lateral rotator of thigh at hip joint.